Hi, it's me, Alexis, again, and I am here with Oren Bar, and he is the owner of Rebalancing Health. And we thought we'd do a little question and answer about Rebalancing Health, what it is, how is it different, um, why you may want to take a visit and see how, what it's about. So the first question we were definitely going to ask is, why did you get into being Rebalancing Health?
All right, so thank you for doing this. The reason I got into rebalancing health, I was frustrated with a lot of the results that I was getting. I was first trained as a massage therapist, then as a paramedic, then as a physical therapist. But I was getting very frustrated with the results I was getting, especially the temporary nature of the results. Patients would come in and they would complain of a pain in their part of their body, the leg, the back, the arm, the neck, and I would treat it based on everything that I had been taught. And they would say, "Oh yeah, that was terrific." But a few days later, they'd come back and they'd say, "Yeah, it all came back." And because of that story kept repeating itself, I wanted to find better answers, better ways of treating the body that I wouldn't get them to coming back with the same complaint. I just wanted to have the problems fixed and for them to go on their merry way and do life.
Okay, so we've seen other videos with you, and I guess a big portion of that would be talk about fixing the switches. So how did that come into play?
Okay, so fixing the switches, that came about as this concept of why were the results so temporary with what I was doing before, and it came to me um, that a lot of these body pains are driven centrally, outputs from the brain that are driving these bodily pains, and that it's like a switch and a light bulb. So if you have a pain here, it's not because there may be something wrong necessarily here, but because there's some output from the brain that is driving this, so that you feel this pain over here. So this is like a light bulb, and the switch is in the brain. And when we uh, um, when we have a light bulb that's on and we go to turn off the light bulb, we don't actually go to the light bulb. Yet everything that I was doing as a massage therapist and as a physical therapist was directed at the light bulb and not at the switch. So that's when I came to this epiphany that we have to address the outputs from the brain, and it's more like fixing the switches and not treating the light bulbs. Anytime you go and you say, let's say a light bulb is on, and I say, hey, I'm going to turn the light bulb off for you. I'm going to put some silver foil on the light bulb. You're going to tell me, well, Oren, you didn't actually turn it off. And then I can say, well, I made it dark. It's like, true, you made it look the same as turning it off, but you didn't actually turn it off, because we all know that underneath that silver foil, the light bulb is still on. The only way you turn it off is by actually going to the switch, which is nowhere near the light bulb. So in the same way, if somebody has a pain here and you're addressing it here only, then you're making it look like you switched it off, but it's only temporary because it's going to come back on.
So I know you also do trauma release with patients. How does that figure in with also their pain?
Yeah, so trauma release is just another aspect. Instead of the the uh, the switch in the brain being initiated by, let's say, a physical injury, it can be initiated by a traumatic event. A very good example of the patient I had, who was held at gunpoint by some bad guys, and they never touched her. They never hit her or came into physical contact with her, but she ended up with chronic neck pain that nobody could take care of or treat. But you can understand from that example how her brain's reaction to that traumatic event um, drove all these outputs and protection mechanisms around her neck, ended up with, chronic neck pain. Yet it's just part of this idea that we don't have to have a physical trauma in order to have physical pain, and we actually don't even have to have the body part that's hurting in order to have the pain. An amputee would be a great example. I've treated people who have foot pain who don't have a foot. The structures for creating the pain are all in the brain, and that don't have to be physically. They don't have to have inputs from the body itself.
So that's also so interesting to hear, because a lot of people go to different chiropractors, physical therapists, and everything, and they're figuring out, well, they're all the same, but you seem to be very, very different from what normal in that realm would do. So in that, I know for your practice, how is your practice structured so that you can really show people how different you are?
Right. So in my practice, I basically I spend the whole session with the patient, one-on-one, doing manual therapy and other techniques to address not only the the inputs, like we said, from the body, but also the outputs from the brain, and that's something that most of the practitioners who deal with musculoskeletal pain, who deal with body pains, do not deal with. They're only dealing with the body parts, again, not the brain outputs. And the field is quite crowded. I mean, we have occupational therapists, osteopaths, chiropractors, orthopedic doctors, massage therapists, athletic trainers, physical therapists. There's a lot of people who are involved in that, but they are, dealing with the inputs, dealing with the body parts, and not dealing with the outputs. So that's one thing that's different. I don't have any of what I call the time fillers or the time wasters, the ultrasound machines, the e-stim machines, the hot packs, the cold packs, and any other number of gadgets. I don't have a gym. There is no a place to do exercise therapy in my practice, and so it does kind of look different because what I'm using essentially is my hands and knowledge, educating the patients in how the outputs are involved in creating their pain experience.
So, and that being said, I mean, this is like really fascinating in how it all kind of connects to each other and what it's doing to your body. And, a lot of people don't think about their brain and when it comes to pain, and to have to now think, what is my brain doing to make me, it's like another level of them understanding their body for that matter.
Yeah, and that's an important point, is that once I start talking about the brain and the brain's involvement in pain, some people, what they hear is, oh, so you're saying it's in my head, or you're saying it's psychological, and nothing could be further from the truth. Okay, when I say the brain is involved in your pain, I mean it's physiological. Okay, and we have we were talking about the pain smoothie. We have components, and the psychological is just one ingredient in the smoothie. But it's by no means do I want anybody to misunderstand that when I say your brain is involved in pain. All pain is created by the brain. Everybody's pain is created by the brain. It's not a psychological thing. In the same way that all hunger is created by the brain. And a lot of other things that we use to understand the world, our perception, our visual perception is created by the brain. So this has nothing to do with psychology in terms of that, oh, you're saying it's in my head or I'm making it up. There's no such thing as imagined pain. There's no such thing as making up pain. I would challenge anybody who thinks that, oh yeah, my wife, it's all in her head or whatever. I would challenge anybody to imagine that they have a pain somewhere in their body that is not currently painful, and for that pain to somehow manifest. You can't do it. We don't have the ability to create imagined pain. So pain is a physiological thing that is created. It's a brain construct that's created by the brain.
So, how does somebody get to you? How do they pay? Once they come to you and be like, oh, wow, this is good. Can they facilitate your treatment?
Okay, so to get to me, essentially, I can be reached by phone or text or phone, 770-815-8512. And I can get you on the schedule. I can also be reached through my website, which is rebalancinghealth.com, or
.now.site.
Rebalancinghealth.site.now.
.now.site.
Rebalancinghealth.site.
.now.site. It is scrolling on the bottom of the screen. So
the website that is scrolling on the bottom of the screen. Yeah, so that also allows you to get yourself on the schedule using the website, and that's it. I don't take insurance, and the reason I don't take insurance is because insurance has a way of dictating the therapy. So every provider, like a physical therapist or osteopath or a chiropractor who's using insurance, actually has a contract with the insurance company. And in that contract, you can pull it up for any contract that says that they will pay for what is usual and customary. That's an insurance term, usual and customary. But in essence, what you're getting is the treatment that's usual and customary. I don't want my patients to get treatment that is usual and customary. I want them to get treatment that is outstanding, exceptional, and effective. Okay, that's the most important thing. And nobody comes here for the magazines in the waiting room or the chit chat. You want to get results. And I think that's a very important thing. If you have chronic pain, you need treatment that is exceptional, out of the box, and not something that's usual and customary. For example, I do a lot of manual therapy. In some cases, I'm spending the whole hour with the patient, one-on-one, doing manual therapy. And yet, for some of the insurance companies, they only pay for 15 minutes of manual therapy per visit. So what ends up happening is the therapists do not do an hour of manual therapy because they'll only be paid for 15 minutes. So then they throw in the time-wasting things like the hot packs or the cold packs that anybody can get at home and do it by themselves. So the insurance is like the tail wagging the dog. It kind of dictates the kind of treatment that you're going to get. So I am not bound by any of the insurance company, rules and regulations. I just do not work with them.
That helps you get patients the care they need at the spot.
Correct. So everything I do is patient-oriented therapy. Okay. One time I wrote on the board where I used to be the director. I wrote Oren Bar has gone to pot. Okay. And people were asking, what does that mean? And so essentially, pot is patient-oriented therapy. Okay. It means that the patient is in the middle, the focus, okay? The patient and getting the results for that patient each and every visit. So I don't have a standard formula that I use for each patient. There's no like a shake and bake that is used for every patient. It's specifically directed at what the person comes in with that day, and the problems that they need addressing. I will do what I can in order to solve that. And it's like I used to be a massage therapist, and it was a sequence, if you like, that I would go through. That's what I was taught, to go through this sequence. You spend this amount of time doing this technique on the arms, and then you go and you do this technique on this leg, this technique on this leg, and so on. There was a sequence that you go through. But what I do now is there's no sequence, there's no preset way of doing something. It's just I go and I find what it is that I need to work on based on what the patient is telling me, what I'm finding, and then I go and I address that. I call it the detect and correct method. Detect the problem and correct it. Detect the next one and correct it. And that's how we go through making people better.
Wow, that was so really something to think about in terms of getting care for anyone who is chronic pain, but any pain at all, because there's so many aspects of it that they may not get to or know, and they may not be told. So it's good to have that clarity and why you're different and how you can help a person differently than maybe where they may have been going, or or in conjunction with where they're going, and see how they can get what they need. So thank you for doing this Q&A with me and helping me to get you more out there and let people know what you do and how you do it and why you do it. And if anyone wants to know more, they can go to the website and scrolling at the bottom and learn more about it. We also have a YouTube channel under Rebalansing Health. You can go in, you can subscribe. We have our other videos about the pain smoothie we heard her talk about, and different ways that pain is channeled through the brain. And you can go through that and check it out. And this also will be on there if you want to go back and learn more and didn't catch it the first time. So once again, thank you for doing this, and we'll see you next week.
Well, thank you very much.